Colostrum, or the first milk, is full of immune-boosting components. As a supplement, it may help with diarrhea, infections, leaky gut, diabetes, and more. Colostrum is a type of milk that breastfeeding women produce just after giving birth. As well as humans, all breastfeeding mammals also produce this nourishing fluid. It's a diverse mix of nutrients such as carbohydrates, fats, vitamins, minerals, and more. Newborns are vulnerable to diseases as their immune system is still forming. They especially benefit from the antibodies in colostrum, which boost their immunity, aids their immune development, and protects them against infection. Its composition is unique and loaded with growth factors that newborns require for muscle, bone, and cartilage growth and repair. Some benefits of colostrum: it may enhance immune defense, may help with leaky gut, may improve diarrhea in people with a weak immune system, can potentially boost exercise performance and reduce infections in athletes. The antibacterial and antiviral properties of colostrum help to prevent diarrhea in 2 studies with over 750 children. It significantly decreased the number of diarrhea episodes. In adults, only hyperimmune colostrum may help to prevent diarrhea caused by specific bacteria and viruses. In a clinical trial with 31 people taking specific IgG antibodies against E. coli from hyperimmune colostrum, it protected against diarrhea. The antibodies were given in powdered form. In 2 clinical trials with 90 adults taking hyperimmune colostrum, it helped to prevent diarrhea from E. coli. In children with E. coli, it significantly decreased the frequency of the diarrhea. People with HIV and AIDS are at a high risk for severe and sometimes even life-threatening diarrhea and weight loss. Specific antibodies from specialized forms of colostrum can help. In 2 studies with 54 patients, 10 grams a day of lactobin colostrum extract greatly reduced diarrhea frequency. 2 studies with 117 HIV patients showed that the colostrum supplement, either alone or combined with regular diarrhea treatment, can reduce the frequency of bowel movements, increase T cell count, support weight gain, and raise energy levels. Rotavirus most commonly affects children and newborns, causing diarrhea, vomiting, and fever. Hyperimmune colostrum may help with this type of diarrhea. In 1 study of 80 children with rotavirus-induced diarrhea, taking anti-rotavirus antibodies from colostrum for 4 days greatly reduced the frequency of bowel movements and overall diarrhea. Patients receiving colostrum also got rid of the virus faster than those taking the placebo. Hyperimmune colostrum eliminated this type of diarrhea within 2 days in a clinical trial with 75 children. This specialized form of colostrum was also effective in babies. In 2 studies with 33 newborns, it prevented diarrhea from rotavirus without any side effects. Infections with the parasite Cryptosporidium can lead to intense diarrhea, especially in people who have low immunity, like those with AIDS. In 1 study of 5 AIDS patients infected with this parasite, hyperimmune colostrum for 10 days decreased diarrhea or reduced the parasite levels. Regular colostrum also helped with diarrhea. In another study, 16 healthy people were given either hyperimmune colostrum with specific anti-Cryptosporidium antibodies or a placebo before being voluntarily infected with the parasite. Those given colostrum had less diarrhea than those who were given the placebo. In a clinical trial with 12 healthy people, colostrum increased white blood cell activity, such as monocytes, and T cell levels. after 1 hour. It also briefly reduced blood levels of natural killer cells. After a couple of hours, new natural killer cells entered the blood, which restored their levels. In another study of 18 healthy people, colostrum did not change the total level of different antibodies after a salmonella vaccine, but it did increase specific IgA antibodies because salmonella is spread through contaminated food and water. IgA in the saliva and gut lining may help to prevent infection. It did not improve aspects of immunity in 198 healthy adults. In mice, colostrum boosted the killing ability of natural killer white blood cells. In pigs, it increased total IgA levels and it activated cells that monitor and block the growth of harmful bacteria. Newborns require the dense immune-stimulating first milk as they just start to adapt to the outside environment. Babies born preterm and those with low birth need to be carefully monitored. They're especially at danger of critical diseases and have a weak, underdeveloped immune system. Colostrum might boost their immunity by raising antibodies and signaling other immune cells to develop. In one clinical trial with 30 low birth weight infants, it raised antibody levels 1 week after birth. However, there was no difference in antibody levels compared to placebo after 2 weeks. In another clinical trial with 64 low birth weight infants, colostrum increased lactoferrin levels 1 to 3 weeks after birth, which may support the immune system. In a clinical trial with 48 premature newborns, colostrum increased both lactoferrin and IgA, and it decreased levels of inflammatory molecules like interleukin-1b and interleukin-8. It also lowered bacteria that can cause strep throat, like streptococci, and it reduced the length of hospital stay in another trial of 99 preterm newborns. Both mothers and supplemental colostrum can enhance the immune response in newborns, while the immune-boosting effects in adults is less consistent. Several studies reveal that colostrum may be beneficial for people with respiratory illness and infections. In one clinical trial of 174 people, fewer people reported upper respiratory tract infection symptoms when taking 60 grams per day of colostrum protein for 8 weeks compared to whey protein. As expected, this benefit might be even more important in children. In one study with 605 children with either respiratory illness or diarrhea, colostrum decreased the number of respiratory episodes by over 90% after 12 weeks. In another similar study, colostrum achieved similar benefits in just 4 weeks. In clinical trial with 31 children deficient in IgA, taking colostrum 3 times per day for 1 week decreased the severity of respiratory symptoms. IgA levels, however, did not change. Colostrum may be helpful for preventing infection in athletes and people who frequently exercise and thus experience a suppression of their immune system. One study examined 20 healthy men who took colostrum or placebo for 4 weeks and then completed a 2-hour cycling session. Taking colostrum blocked the decrease of an important immune enzyme, lysosome, and it increased the recovery speed of white blood cells, or neutrophils, following the training. In a study with 29 elite cyclists, colostrum protein supplements for 5 weeks improved symptoms of upper respiratory tract illness. These supplements supported the immune system by preventing a drop in T cells and IgG antibodies after exercise. IgA antibodies are important for protecting against respiratory infections. In long-distance runners, taking colostrum for 12 weeks significantly boosted the levels of IgA in the mouth. In 2 studies with physically active men and highly trained swimmers, taking colostrum relieved upper respiratory illness. Some clinical evidence suggests that colostrum may help the body fight off respiratory infections, especially during the periods of immune suppression that typically follow heavy exercise. Colostrum has been called the baby's first vaccination. Interestingly enough, 2 studies with 285 people suggest that colostrum, either on its own or in combination with other drugs, may be a superior means of prevention when compared to a vaccine. People who took colostrum had the flu for fewer days than people who received a vaccine. That said, the trials included younger, healthy adults. This effect is yet to be investigated in the elderly and people with compromised immunity. In mice, taking purified antibodies from hyperimmune colostrum prevented infection after subjected to a flu virus. Mice who took these antibodies and got an otherwise lethal dose of the flu virus survived. In another mouse study, colostrum reduced flu infection severity, prevented excess weight loss, lowered the viral load in the lungs, and it increased white blood cell or NK cell activity. Taking antibodies, including immunoglobulin A, from human colostrum after a flu outbreak prevented infection from the influenza A virus in rodents. Lean body mass is your total body weight minus body fat. It can be a good way to keep track of your health and your muscle gains. One study looked at the effects of supplementing workouts with whey protein versus colostrum during an 8-week training period. Unlike whey protein, which increased total body weight, taking colostrum significantly increased lean body mass. In another study with 19 people, participants either took colostrum or protein supplements for resistance training. Both colostrum and regular protein supplements increased lean body mass, total body mass, and strength. Based on this study, colostrum may not be superior to whey protein or casein. In a study with 40 middle-aged adults, colostrum increased lean body mass and upper body strength during resistance training. The benefits were similar to that of whey protein. On the other hand, in a study with field hockey players, colostrum improved athletic performance more than whey protein, but there was no difference in their lean body mass. Some people use colostrum to increase muscle during exercise. Colostrum may enhance athletic performance in both highly trained athletes and less fit older adults. Still, its benefits were not superior to whey protein in most studies. In 2 studies with 71 elite cyclists, taking colostrum supplements led to a faster performance in cycling races. At the end of the training period, the effects of colostrum were similar to that of whey protein. In another study of 51 men who underwent resistant and plyometric training, those who took colostrum supplements had a significantly higher vertical jump, could use more force while cycling, and had strength increases after 8 weeks. One clinical trial studied 35 elite field hockey players. They either received colostrum or whey protein for 8 weeks. In this study, colostrum improved sprint speed and vertical jumps better than whey protein. In a study with 40 older adults, taking 60 grams of colostrum per day for 8 weeks while working out increased upper body strength, lean body mass, and cognitive function. One study examined people who were trained recreationally. Participants taking colostrum with other supplements increased their lean body mass, total body mass, and strength while resistance training for 12 weeks. These effects were similarly compared to taking casein and whey protein. Colostrum may also aid in the recovery after exercise. In one study taking colostrum for 6 weeks, it lowered muscle damage from exercise and it improved performance in the long run in a group of 18 high-level soccer players. In a study of 13 world-class female rowers, it did not improve performance. Colostrum is sometimes used to improve exercise performance and shorten the recovery period, and clinical studies have found some positive results in both athletes and non-athletes. Colostrum may be helpful in Alzheimer's disease and age-related memory loss. In a clinical trial with 46 mild Alzheimer's patients, those who were given colostrum either improved or didn't worsen. None of the patients given a placebo or selenium showed improvements. In 2 studies in 138 Alzheimer's patients, long-term colostrum use for 4 to 28 months slowed down the decline in memory, cognitive function, and daily activity. In aged rats, colostrum delayed spatial memory loss and improved learning. In people with leaky gut, a weak gut barrier lets harmful components like bacteria and toxins sneak into the bloodstream. 2 less-known causes are intense exercise and excess use of non-steroidal anti-inflammatory drugs. One study provided 16 athletes with colostrum or placebo for 20 days. 75% of the athletes in the colostrum group initially had leaky gut, but the condition significantly improved after supplementation. Another study examined 12 volunteers who underwent intense exercise. Those who didn't take colostrum had a dramatic increase in leaky gut after exercise, while the increase was much milder in those given colostrum. A combination of zinc carnosine with colostrum may provide additional support for healthy leaky gut after exercise. Taking either zinc carnosine or colostrum alone for 2 weeks prevented an increase in leaky gut by about 70%, while taking both blocked it by 85% in a study with 8 people. Other studies cast doubt on the benefits of colostrum in leaky gut from exercise. In one study with 30 healthy men, taking colostrum every day for 8 weeks actually increased leaky gut that was caused by exercise. A study with both athletes and non-athletes showed that it did not improve athletic performance or reduce leaky gut that was caused by exercise. In a clinical trial with 7 men, colostrum prevented leaky gut from non-steroidal anti-inflammatory drugs. Those who took the drugs without colostrum had a 3-fold increase in leaky gut, while those taking both the drug and colostrum didn't worsen. In a rat study, administering a non-steroidal anti-inflammatory drug, diclofenac, led to leaky gut, and giving colostrum before the non-steroidal anti-inflammatory drug helped to prevent the leaky gut. Aside from leaky gut, colostrum may prevent other gut problems that non-steroidal anti-inflammatory drugs can trigger. In rats, colostrum lowered small intestinal damage, protein loss, gut bacteria, and leaky gut that was caused by the non-steroidal anti-inflammatory drugs. Colostrum may help to prevent bacterial infection after surgery. In one study with 40 patients, a specialized colostrum preparation for 3 days prior to abdominal surgery led to significantly lower levels of bacterial toxins. In another study with 60 patients undergoing heart surgery, taking 42 grams of colostrum per day for 2 days before surgery lowered inflammation levels of interleukin-6 and CRP. However, it did not lower bacterial toxin levels. In one study with 16 diabetic patients, taking 5 grams of colostrum twice a day for 4 weeks lowered blood sugar, cholesterol, ketones, and triglyceride levels. Another study used tablets made from goat colostrum. In 27 diabetic patients, they reduced blood sugar levels and the required insulin dose. In diabetic mice, a fraction of colostrum, an IGF-1 fraction, significantly lowered blood sugar levels. Non-organic failure to thrive is a condition where young children do not grow properly due to unknown medical reasons. In a clinical trial with 120 children with this condition, colostrum significantly promoted weight gain and improved health after 3 months of supplementation. In a study with 14 patients with colon inflammation, colostrum enemas, along with standard treatment, relieved inflammation symptoms better than the drug alone. In mice with colon inflammation, colostrum lowered many inflammatory markers. However, it also lowered interleukin-10, which is an anti-inflammatory cytokine. In guinea pigs, it reduced the symptoms of ulcerative colitis. So colostrum shows weak but promising potential for lowering colon inflammation. Colostrum is extremely important for healthy immune development in newborns. Bovine colostrum supplements, on the other hand, are widely used by adults to increase immune defense, relieve diarrhea, boost athletic performance, and more. Colostrum may also improve gut inflammation and help with conditions like diabetes and Alzheimer's. Traditional use by the gypsies, when anyone was sick, they'd be given donkey's colostrum to help to heal them.